This is the news chart that we are using at Velindre. When starting observations, add all patient information, addressograph, ward, consultant, adding the date and the time of the observation. The frequency of observations will be determined by the first set of observations taken. In all patients' folders at the bedside, there is a news tool. This gives clear monitoring, alert and review guidelines. Jim arrives. All observations are within range. News is 0, indicating 12-hourly observations unless the patient deteriorates or there's any cause of concern. Rosie attends and she has been unwell at home. She has a respiratory rate of 22, SATs of 94, a temperature of 38, a blood pressure of 109/60 and a pulse of 94. Rosie's news is therefore a 6. 2, 3, 4, 5 and 6. She is alert, so it is 6. As Rosie is a new patient, observations should be done every 15 minutes for the first hour and continue with the guidance. In accordance to a news of 6, the patient should be reviewed within 30 minutes by the SHO, with escalating to the SPR if necessary, considering the administration of oxygen, commence a fluid balance, take bloods and ensure results checked. Consider an AKI. For further assessment of Rosie, we turn the page and there is another screening tool. I have ticked the boxes ready. Rosie had a respiratory rate of 22, a temperature of 38 and a heart rate of 94. Therefore, Rosie has SIRS, Systemic Inflammatory Response Syndrome. To us, that's a sign of infection. Since Rosie's attended the ward, she's also had a cough. It's also become apparent that Rosie had chemotherapy 10 days ago, so we are also querying neutropenic sepsis. We follow the pathway down, and the handy tool of this is the SBAR. So when we are contacting the doctor, we can do it in the SBAR. So the situation would be news of 6, new admission 10 days post-chemotherapy. She's a CA of ovary, unwell at home for 3 hours. Query sepsis, query neutropenic sepsis, and she is deteriorating. Recommendation would be to assess the patient within 30 minutes, follow recommendations, BM, ECG and bloods. Due to COVID-19, patients will present with raised news and query sepsis. This is our severe sepsis screen pathway. So again, looking at this, we need to document clearly what we do. This is for the first hour of care. So checkpoint, is this patient neutropenic? In Rosie's case, yes, but in light of COVID-19, that might not be the issue. Okay, could this patient have sepsis? Yes. Apply the severe sepsis screening tool and we start the clock. This is the start of our golden hour. Oxygen saturations, blood culture should be taken. When we're looking at the blood, it's FBC, RLB, COAG, CRP. And I'll show you a picture of those. IV antibiotics should be given within the first hour. Fluid resuscitation, IV fluids, serum lactate. So this would be a VBG, a venous blood gas, which should be taken when we're taking all the bloods. There is a iStat analyzer down on CIU where we can get the results of those, which would be important for anyone who's doing venipuncture. Catheterize if required and commence on a fluid balance. Here you document time, the initial. If for any reason you're not doing something, oxygen is often a common one. It could be that the oxygen levels are 94, which is stable for the patient, or doctor has indicated no oxygen required. But make sure you fill in all the boxes to cover yourself. Going down, just saying if you've discussed with the SPR or the consultant, and again, keep filling it in. At the end it does say 1 hour time check, all steps done, yes or no. If it is, then press yes. If no, you know you've done the best you can, and just be honest and put no. It's not a problem. Good luck everyone. Bye.